Hello, everyone. Welcome to the second episode of Pretty Huge Disaster Life Under Lockdown. We have made it this far. Wow. Um, so, in case you didn't catch the first episode, I'll just give you the spiel again. What is this? So, we're a group of first year PhD students from Trinity College Dublin, University College London, and Imperial College London. And we're all part of the same CDT, which is the Centre for Doctoral Training in the Advanced Characterization of Materials. So we're all physicists, chemists, engineers doing research in material science. My name is Annie and I'm from Trinity College Dublin. The other guys will present themselves as we go around. So just to start, before we begin, I would like to point out that any of the opinions expressed in this video or any of our videos are entirely our own and they in no way represent our universities, the funding bodies, or any other institutions that we are associated with. So we'll get started. First of all, I want to ask you guys what you've been up to over the last week with working from home. Samia, how have you been getting on this week?
Hi, I'm Samia. I am based at UCL, and what have I been doing? Well, we mentioned last week that routine was really important, but I think I want to add that variety as well in the kind of work that you're doing is key. So I've been signing up to loads of different online webinars that are relevant to my project, but also webinars that aren't relevant at all. Usually when I go to uni, I'm always listening to podcasts and stuff and little things like that you just don't get to do anymore. So I've been trying to do that a lot. And also, really lamely, exercise is just
No, it's not lame.
I just love it. And it's keeping me sane. So yeah, that's pretty much what I've been up to and how I've been keeping busy. What about you, Jamie?
I've been doing all right. So I'm Jamie, down here in the corner of your screen. I am also at University College London, and in terms of what I've been up to, I actually felt like I've done quite a lot of things with friends that I wouldn't normally see that often. People who live in different cities who, normally I would feel like I wouldn't meet up with because they're far away. But now sort of everyone's far away, but that also means everyone's equally close. And so we found quite a lot of ways to do things that we normally do in person over the internet. So I quite like to play board games, and so we've been doing that online. And yeah, that's been nice. In terms of work stuff, I think it's I've been having to do quite a lot of reading for my project, as I imagine a lot of PhD students are. And one thing I've been finding, this is a more general thing, but one thing that really helps, I think, is to actually, if you're reading a paper, to actually print off the thing. And then I like to have my highlighting pens and color code everything and do lots of annotations. And it just feels like I'm doing something when I'm actually reading it, as opposed to just sitting and reading some text on a screen and just dying of boredom. So yeah, that's been me. Ollie, what have you been up to?
Yeah, kind of similar to you. I've been doing lots and lots of reading for my project, and I think I'm learning to try to be kinder to myself, because the other day I had a really slow work day. It's one of those days when nothing's working. Mm-hmm. You can't get your brain into gear, everything's bad. And I was moping around the house, I'm everything's terrible. I hate reading, everything's so bad. And then I just wasn't having a good day, and I managed to finish a paper, and I was like, you know what, there's no point doing anything else the rest of the day because you're just not going to remember anything. So I gave myself everything off, the rest of the day off. And then the next day I got up and I was like, oh, I actually feel like reading.
Yeah.
I actually feel like this is a much better day. And I had quite a productive day the next day. So I think we're not in a usual work situation. It is hard to just be sat on your own reading all the time. So I think allowing yourself to find it hard and being kind to yourself and letting yourself take breaks and not forcing yourself to sit in front of a screen if it's not actually working for you is quite a good thing that I'm learning. But yeah.
Okay, that is fair. I think I need to do more of that because I just find I'm becoming less productive as the time goes on. And then in the evenings, I'm worrying more about how little I will actually have gotten done by the time we get back. This week, I didn't really get to do much of my own work at all. Like not a lot of reading or anything. I was doing some outreach stuff, so still work, but not reading. And that took up a lot of time. So I was filming an educational video about material science for kids. And the video itself is apparently only going to be about like 5 minutes long, but it took 8 hours to film.
Wow.
So yeah, that was a fun, stressful day.
Do you want to tell us what the video is about?
Yeah, so it's just about material science in the home. So it's talking about different objects around the house and what they're made of, and kind of talking about the difference between an object and the materials that object is made of. Okay. Yeah, but I won't give you any other spoilers. You'll have to catch it whenever it goes live. But yeah, that's me. So I'm kind of hoping that this evening, tomorrow, next week, I'll actually get back on the reading train and get some work done, and I'll feel better about that. Okay, nice. So instead of harping on about working from home, everyone is doing it. Maybe we will move on to the journal club style discussion element of the videos. So last week we spoke about science denialism around COVID-19. If you want to catch up on that, you can check out our YouTube channel, or you can now check out our Spotify, because we now have a podcast version. So yeah, but this week we are talking about COVID-19 testing methods. So for this week, I have pulled together just a few headlines and a few news articles that I found from different countries, how they're testing. So I am going to share my screen and pull up PowerPoint. Share screen. PowerPoint.
Nice.
It worked. So, okay, so as I said, COVID-19 testing methods. Okay, so first off, I just wanted to actually talk a little bit about how the tests are actually carried out. I will point out with this slide that I am not a biologist or a virologist. So this is stuff that I got from digging around on the internet. But I've just taken it at a very basic level so we can talk about it. First off, testing seeks to identify the virus itself, SARS-CoV-2, otherwise known as COVID-19. And this is done either by detecting the presence of the virus itself, so to see whether you have the virus or not, or detecting antibodies produced by the body in response to the infection to see if you have had the virus. Depending on which test they're carrying out, they do it differently. So if they are detecting the presence of the virus itself, they take a swab from the back of the nose or throat, or from sputum, which was a new word for me, which is a mucus coughed up from the lungs.
Lovely.
Yeah. Otherwise, if they're testing for antibodies, they take a blood sample. And then as for the swabs, they're taken to a lab, and a technique called reverse transcription polymerase chain reaction is carried out to quantify viral genetic material. So I think really all that means on a very basic level is the technique is used to kind of look for the fingerprint, essentially, of the virus to see whether or not it's present. And while I was looking around, I found this really nice, clear infographic from the BBC just detailing the difference between the two tests. So kind of as I said, the swab is diagnostic, blood test is antibodies, and it's interesting how long each test takes. So we're talking either days for diagnostic or seconds for the blood test. And yeah, for the blood test, it just says solution added to test device, but apparently that's just kind of like a pregnancy test. Like you put the blood sample into the device and it tells you whether or not the antibodies are present. So that's how the testing is carried out. I then started digging into like, where do I start with talking about how different countries are testing, what they're doing. And I found this article from the Business Insider from April 20th, so it's just a few days old. But this article had pulled together some data from these 6 countries here about their testing rates. From reading the article, I couldn't really see a main reason for why they picked these 6 countries. I think maybe just to get a broad scope of comparison, but it just shows some of the testing rates for those. And then mainly what I wanted to pull out from that was this quote, because before I begin a presentation where I compare loads of different countries' testing rates, I want to point out that there are potentially some inaccuracies in comparing different countries' testing rates, because apparently not every country reports testing rates using the same metric. So apparently the UK reports it as people tested, the US reports total results, Japan reports it as persons, South Korea reports it as cases, which personally I find a bit confusing because it kind of sounds like it's implying they've tested all known cases. Turkey. Oh, sorry, yeah.
I was just gonna say, I think South Korea's testing has been like very extensive compared to a lot of other countries, and the thing is they started testing way sooner, right? Like one of the things about South Korea is they don't actually have an enforced lockdown, and the government's been encouraging people to social distance, but the reason they've been able to sort of get away with that is because that like when they had just like a handful of cases, less than 10, the government was suddenly started to build up these big testing centers, and they've been able to do very, very extensive testing. I think that's why I think like the total numbers in South Korea are much lower than other countries. And I think they basically have like their plan is basically to essentially track down almost all the coronavirus cases in the country.
Yeah, they're doing a lot of tracing.
I think they've been really, really successful, haven't they? They've only got like a handful of cases still, like compared to all the other countries. It's crazy.
So it goes to show how important testing is.
Yeah, exactly. And then just to finish that, Turkey says number of tests, and then Italy says number of swabs, which sounds like just the swab tests, the diagnostic ones. But I have read that Italy are also carrying out the antibody tests. But it sounds like then maybe they're not counting that towards their total number of tests. I don't know. But anyways, so because they pulled out these 6 countries, and I didn't really know why, also it's a few days old, I decided to spend an hour on Excel and make my own chart.
Nice.
We have a question that's just come in.
Oh, yes.
So from Dylan Lynch, that's really confusing. Surely it'd be easier for countries to stick to a logical metric, like number of confirmed cases amongst those tested or number of residents with confirmed COVID-19. I mean, I guess that kind of answers itself, really.
Yeah, no, definitely.
Yeah.
What do you guys think about that?
I mean, I guess is it due to a lack of communication between different countries? Yeah.
I think that'll be important in future pandemics. Then now we can know like we need to make sure for the future that we are all reporting the same. I think that's one thing to learn probably from this. Like it's such a like everything happens so quickly, and that people aren't going to be like immediately knowing the best thing to do, so they're just reporting it as they are. And so future,
and transparency is really important as well, because it's a global virus that doesn't discriminate between different countries, so it's very important to communicate your findings accurately and clearly, I think.
And definitely. I suspect in the aftermath of this I certainly hope there will be something put in place, like guidelines that all countries will have to follow, that I think will include standards for these sorts of things.
Then maybe this is kind of good to follow on from that comment, because I'm sure a lot of people are familiar with this website anyways, but worldometers.info. So they're kind of taking the live statistics as each country is announcing them, and they're using the same metrics to compare everything, which is, quite clear. Well, I mean, I guess maybe they are using the data that other countries are calling swabs and tests, but anyway, so yeah, as we said, that is definitely a really good point. They should all kind of use the same standards. But I collected this data from, as I said, worldometers.info. And I first started looking at the tests per 1 million population because, obviously we're talking about testing rates. But I found that was a little bit skewed because at the very top, all the high testing rates are from quite small countries. So it's a little bit skewed because, they're smaller countries, they have smaller populations, smaller number of cases, they're able to test more. Now, if you do go by that metric, Iceland is winning by far, and they are doing a really great job with their testing rates. But to make it a bit more of a fair comparison and to highlight some of the countries that are in the news all the time now that we're constantly hearing about, I instead organized the data by the total number of cases that the countries have confirmed. And I then took the top 20 countries that have the highest number of cases. So that's them here. Was someone going to say something there?
Yeah, just a quick point though. If the testing per million is different in every country, then surely the total cases as well is going to be different than what we're seeing here, right? It's not going to be that accurate. Like, you can't really compare the two, can you? Do you see what I mean?
Yeah, I think what Sammy is saying is like that this number of total cases is the number of total cases according to their own testing metrics,
exactly.
right?
How many people are being
if
tested.
Anything, but yeah, I think, and that's definitely very true. Yeah, no, for sure.
Yeah, definitely, and that even leads back to again that comment on what we were saying, like all of this would be a lot more accurate and useful for countries to continue planning for how they'll do their lockdowns and their social distancing measures if they could compare their data to a widespread data set where everyone was using the same metrics. Everything would be a lot easier. But of course, there are inherent issues to why there are differences between testing in different countries, and I'll talk about some of those. But so just to go back to this chart here, I organized it by total number of cases. So here's the top 20 countries that have the highest number of cases. Also organized by total cases per 1 million of their population. And then I looked at their testing rates to compare those countries. I'll point out that China here is a bit of an outlier because we spoke about this in the last video as well. Their first cases were obviously in December. They didn't really start announcing globally their cases or their testing until January, February, so there's not a lot of data on their testing rates. So I'm going to start from Portugal onwards. So as you can see, I've just highlighted a few countries along the side here. I'll explain why in a moment. But to start with Portugal, they seem to be doing a really great job. They have a really high testing rate. They have, half the number of cases as their neighbouring country, Spain. Switzerland also doing well. I hear dogs barking.
Sorry.
No worries. Italy also doing very well. Of course, they got hit very badly, so they have really ramped up their testing rates. And I was pleasantly surprised to find Ireland in this top 5. Now, for a small country, we have, it's alarming to see that we are in the top 20 for highest number of cases. But we have really ramped up our testing in the last couple of weeks as well, so very happy to hear that. Spain and Belgium also following with pretty high testing rates. Next, USA and Netherlands. I've highlighted them in yellow because it's a little bit problematic. They have, their testing rates are catching up. Of course, the US in particular, their testing rates have ramped up hugely in the last week even. Netherlands, I would say maybe should follow. But then below here, UK and France, for the high number of cases they have, their testing rates are quite low. So I'm going to talk about that in a little bit as well. Any comments on my beautiful chart here?
I like the colour scheme.
Just going back to the thing Samia said about how to compare the total number of cases between these countries. This one very rough thing I guess you could do is multiply the number that they say for the total number of cases by the testing rate. Divide by the testing rate.
So how many people test positive per case?
Yeah, because you'd expect
per 100 tests or whatever.
Because you'd expect that countries that test more, like Ireland, obviously they're going to see that they have more cases, and perhaps one of the reasons that Ireland supposedly have a lot of cases is just that they've done a lot of testing,
more
right?
tests, exactly.
That is a really good point, because I remember when all the stats started coming out about the US in the beginning, about like where the hubs were or the clusters. I saw articles saying like Seattle is the hub for COVID-19 in the US, and I was like, oh my god, what's happening? And then when I looked into it a little bit more, it was just that Seattle were the first city to start testing for it. So of course they had a higher number of cases than everywhere else. But yeah,
there's also there's a prison in Ohio that tested like 73%, I think, were positive. No deaths, but it's just because they are literally testing every single person there, which isn't happening in other. So although it might seem like, oh my gosh, there's so many people there who are positive, it's just not really a fair comparison at all, because not everywhere is being tested the same.
Yeah. Totally fair. So this next slide is just about Portugal in particular. Sorry, someone's feedback is very loud.
Me. I don't think it's me.
Oh, there. That's a lot better. I think it might have been Samia.
Really?
Sorry, I was just getting like huge feedback into my ears. I was like,
Okay, I definitely wasn't getting huge feedback. There was a little bit of background noise. I think we should keep going.
No worries. So this slide is just about Portugal. As I said, they have one of the highest testing rates. I found this from a website called Rights and Freedoms, and this headline says that Portugal is treating migrants as citizens amid the COVID-19 crisis. So they recently announced that they will grant temporary residency rights to all immigrants and asylum seekers who applied for residency in the country before the country's state of emergency was announced. Personally, I think that is a great idea. I can see why the headline is saying other countries must follow, because at the end of the day, those people are also in your community, and they are the groups that maybe have less access to healthcare, less access to suitable housing. And so if they're not being protected, then they are the weakest link in the chain, and there is a follow-on effect to everyone else.
Annie, just quickly, we have a question from your last slide.
Yeah.
So from Joseph Akinloton, it says the majority of countries listed are more economically developed countries. Do you think greater focus needs to be placed on testing in less developed countries who may not be able to mitigate the spread as effectively?
That is a good point. If you look at the statistics, a lot of lower income countries actually so far seem to be hit less badly than more economically developed countries. Like, I remember people kind of saying a strange thing about COVID-19 is that it's almost kind of hitting the more well-off countries, because a lot of us seem to be in a more milder climate, and there was some speculation as to whether or not the temperature of hotter countries was kind of helping the virus, helping put a halt on the spread of the virus. So at the moment, it doesn't seem like it's a huge cause for concern. Like, the huge hubs for the virus don't seem to be in less economically developed countries. But if they were, I would be very worried. Yeah, definitely. And I think it would definitely be time for, larger powers to step in and help with their resources.
I also think that we have seen, like, in other countries, more outbreaks, right? So in the past, like Ebola and stuff like that. So maybe there is like more of an effective.
Samia is frozen on my end.
No, she's good for me.
She's fine for me as well.
Sorry.
Is Samia still frozen for you, Annie?
Oh, sorry. Did I freeze? I'm back now.
No, you're fine.
But what was I
Okay.
saying? I was saying that so in other countries, we've seen more outbreaks, so they might be more prepared in situations like this. So maybe like the government have taken action quicker. I'm not entirely sure, but that could be a factor that helps.
I think one of the things as well that we were talking about earlier about the kind of testing fallacy, where you don't see as many cases where you're not testing for them really. I think that might come into play with the less economically developed countries, especially if there are lots of people in rural communities who perhaps aren't going to have as much access to the testing facilities. But then kind of counter to that point as well, perhaps they won't have had too much kind of been impacted as much by the outside world and stuff like that. Because I think part of the reason for this spread of the virus is that lots of people traveled to different countries and got on planes and took it back with them.
Yep.
So perhaps in these more rural communities, they haven't been impacted by that as much. I don't know. I don't think it's a simple
But I mean, you have
really
busy cities and
you do have busy cities in those countries as well. Yeah, definitely, like huge population centres as well. So I don't know. I think it's quite complex.
Definitely.
Yeah.
So to just finish up about Portugal, there was I was here, I think. As we said, Portugal has been praised for its swift COVID-19 response, and rightly so. As I pointed out earlier, they have half the cases of their neighbouring country, Spain, and there's still some speculation as to why they've been able to do such a great job. But apparently, they were very early to impose restrictions. So this says here that they put in place a kind of lockdown after the country had only witnessed 2 deaths. Also the first EU country to open a drive-through testing centre. Recently announced that they would extend their lockdown until May 1st, which is sooner than Ireland. We're set to lock down until May 5th, so interesting to see when countries are thinking of opening up again. And then just to finish with this quote from their Prime Minister, there is still no light at the end of the tunnel. We have to walk through this tunnel, and the more disciplined we are now, the faster we will get to the end of it, which I think is a point that is relevant to everyone.
Yeah, I guess one thing to say about that is they've said they'll extend their lockdown until May 1st, but I'm guessing that they'll extend it till then and then sort of review things and then quite possibly extend it even longer.
That is what seems to be happening everywhere.
They do see the light at the end of the tunnel, and I think the light can come through more sort of extensive testing and contact tracing, so that the only way you can, because obviously the problem with opening up after a lockdown is that you could just have the exact same situation again, right, where you just get a second wave of cases, and so you need to have something else in place to stop the virus, and some sort of extensive drive-through testing program could be that something else.
Also, sorry, go ahead, Annie.
Oh, I was just going to say, I think when countries are opening up again, it will obviously have to be phased in. Like, I think they'll phase in certain jobs. I mean, Ireland has said that no pubs or restaurants will open until there's a vaccine.
Right.
So it's very very phased process by the looks of it.
I was going to say that phasing is important, but what's kind of worrying is that we are basing our lockdown period on these number of cases, which, as we've said, is just not reliable. So it's just difficult, obviously, to know when is the right time. But I think, obviously delaying as much as possible is the only way you can really do that. But I don't think we should be basing it on the testing or the peaks that we're seeing in the statistics, because themselves are inherently inaccurate.
Yeah, that's fair.
I'm really impressed with Portugal. I just wanted to say, that's really good.
Is someone clapping?
One thing I would say though is that I don't think the data's completely useless. Even
No.
though, as you say, by not testing everyone, we're missing out on a huge fraction of the cases. But if you like see what we've seen in this country, right, is that initially we had this sort of rapid exponential growth in the number of cases, whereas now the number of new cases each day is kind of constant, roughly speaking. And although that constant number that we're putting out is almost certainly way less than the true number, because the sort of fraction that we're testing from day to day is also fairly constant, that still means that the overall picture of a sort of rapid exponential growth in the number of cases, which then sort of trails off to become a more sort of constant linear growth, is still true, right? Even if the numbers aren't right, the overall picture of the trends are probably still right.
Yeah, I think you can say that probably extrapolating, that's probably true, but I'd still rather have.
Yeah.
Oh,
and
for
also
sure. I'm not
they're-
disagreeing
yeah.
with that. We
They're
definitely
only
need to
testing
be.
people like in hospitals and stuff like that, where like there's bound to be like more cases and things like that. I don't know.
Yeah, and
It's all a
definitely,
bit of a mishmash, but yeah, I agree with you. Like I mean, it's better than not basing it on anything, right?
yeah, sure.
Guessing.
Yeah.
Yeah. I mean, in this country, you know, yeah, if you're not in a hospital, you're not getting tested. So people who are at home or in care homes, like, there must just be loads of cases that just aren't getting noticed.
No, yeah.
That is the same in a lot of countries, and I will mention that as we go
All
through.
right.
Yeah, and it's
So
a
then
problem.
next, my computer. There we go. I couldn't change the slide for a second. So next to talk about Spain, the neighbouring country of Portugal. This article is from RTE. So Spain plans to widen testing for COVID-19 as death rate continues to drop. Now this article is from the 6th of April. I could have pulled something a bit more recent, but I think it's nice to see, like, you know, look back at 6th of April and now compare where Spain are now. So just a few bits from this article. A quote here from the Spanish foreign minister: "We are preparing ourselves for de-escalation, for which it is important to know who was contaminated to be able to gradually lift Spanish citizens' lockdown." So, I mean, as you said, Sammy, at the moment, a lot of countries are only testing hospitals, people who are, you know, most likely to be in contact with it. And this is kind of showing us that as the curve seems to flatten, as there's less of a demand on healthcare systems, you know, countries are broadening their testing range and trying to, you know, I don't think it will ever be possible to try and test everyone, but you can get closer to that goal, or at least try and work towards that. Now, this here, again from the 6th of April, said that Spain would remain in lockdown until the 26th of April. That has now been extended to May 9th. So, you know, they've been talking for a month now about slowly easing up the lockdown, the curve flattening, but still extending the lockdown. So I'm not sure what to infer from that. I think things are still good. I mean, if we look at this chart here, this is from Worldometers again. Since the 6th of April, roughly, their curve is starting to flatten. There's a bit of a peak in the last few days, but it is flattening off a little bit. So maybe Spain can be hopeful for winding things down in May at some point. What do you guys think?
I think it'll be a lot longer from May until things go completely back to normal. And I think it's quite hard to predict these things, because even if the curve is still flat, that's still around 100k active cases. So that's still at least 100,000 people with coronavirus who are infectious. So yeah, I don't know. I guess it depends. It depends on the Spanish healthcare system as well, like whether they could cope with another peak, all of this stuff. And also, yeah, it depends on how effective their testing is. I think, yeah, it says here that they want to widen it to include people without symptoms. I think you said, which is, I think, good. I think, yeah, widening testing's great, really good idea.
Yeah, point. Like, it's better to be safe than sorry, you know.
Definitely.
There's been such an amount of loss in everything, the economy, people. So why not just wait that little bit longer when you can be sure, rather than just like a flattening of a peak? I don't know.
For sure. I think one thing you said, Annie, almost sort of jokingly, is, you know, maybe they should widen it, try and test everyone. Well, you couldn't test everyone, obviously. But I think the way around that is to, once you have tested some people and identified them as positive, then figure out who they've been in contact with and test those people. So in
Yeah.
terms of deciding who to test without symptoms, you've got to make sure to test people who have likely been in contact with people who have had the virus, and that's
Like playing detective.
pretty much, yeah. And I think that's things that countries like
house.
China and South Korea have done very well. I mean, they have tools. The government has tools there that allow them to look at what the population's doing a lot more than governments in these countries have. But I still think that, you know, something of that nature can be done and should be done.
Yeah, the tracing method is definitely the most successful approach. Like you said, South Korea have been following that method, and it's worked great so far. I have a friend in South Korea who has been posting Instagram stories on how life has been since they've started easing up the lockdown. So I mean, she's able to go out and get her hair done. She's able to go and go to a restaurant. But there are logbooks at the door where you have to have your temperature checked and you have to say who you've been in contact with in the last while. So yeah, tracing is definitely key.
Yeah, I think that's a really good idea, and the flattening of the curve is definitely very positive. It's a good thing, and it shows
Yes,
that the lockdown's been
absolutely.
working. So that's good.
Hashtag flatten the curve. So I'll move on to Ireland. Here we go. So the Irish Times. I'm starting from April 2nd here. So this article, so even just put a little bit more context in, Ireland got their first few cases in the beginning of March. We've kind of been in shutdown since mid-March. And so April 2nd here, it says how many tests have we done? What happened to the goal of 15,000 tests a day? So in the beginning of April, it said that we had only done 30,000 tests total, and only 14 labs were producing about 1,500 test results a day. So far off from this 15,000 tests a day goal. But then if we fast forward 5 days and go to April 7th, from the journal.ie, still short of its testing targets, but we had already conducted another 12,500 tests. And then Dr. Killian de Gascon of the National Virus Reference Laboratory said the country is still a number of weeks away from reaching the 15,000 tests per day goal. But now if we go to the 19th of April, the HSE, which if people don't know is kind of the Irish equivalent of the NHS, says that there is now a zero backlog in COVID-19 testing. So over the space of, maybe 3 weeks in April, we seem to have really caught up. And how did we do that? So now, if it will change the slide, again from as I said, just with the shutdown, this is from March 25th. I wanted to point this out because I said we were in shutdown from about mid-March, and by March 25th, they already had to impose restrictions on who they were testing because of people panicking, and 20,000 people every day for the last 10 days wanting to be tested for COVID-19. So, I mean, it only took a week or two for people to panic and everyone wanted to get tested. And so the HSE said, we can't do that realistically. And so they imposed these restrictions where people in contact with a confirmed case, healthcare workers, or those within vulnerable groups, prison inmates and workers, and those who live in long-term care facilities were the only people that could get tested. And fair enough, because 20,000 people every day is a very large number of tests being sought. Now, if we go to, I really wish I didn't have to quote the Irish Mirror, but it was hard to get an article that just said, when the lockdown was extended to. So our first lockdown was meant to last until Easter Sunday. Then on Easter Sunday, our Taoiseach said that it would be extended for another 3 weeks. So we're now looking at May 5th. People have been positive about this, saying that maybe they will try and start phasing in some jobs on May 5th. But recently in Irish media, there's been a lot of warnings from the government saying that if we don't continue to take the shutdown seriously, things will not ease up on May 5th, because there's been a lot of talk of people now starting to be pretty laxy-daisy about the lockdown. Yesterday, live cameras on one of Dublin's main streets, O'Connell Street, counted 57,000 people out walking over the course of the day. Wow. So that is not good. People, stay home. Stay home.
Yeah.
So that's just a little bit on our lockdown. So now back to like how we ramped up the testing. This is from Monday this week. Ireland is able to perform extra tests thanks to equipment sourced in China. So now, never mind the 15,000 tests a day goal. Apparently, we now have the capacity to perform 100,000 tests a week due to this new equipment. Now, it does say that it could take a few weeks to coordinate the efforts across the country, but I think that sounds really positive.
Yeah, really positive.
Any thoughts on this?
I was just wondering. Oh, sorry. I was just wondering, like, what the main kind of thing stopping testing is. Is it limited supplies of testing agents, or is it infrastructure? I don't know.
I mean, it's a bit of both. So here, if you look at the bottom, Professor Mallon said Ireland encountered the same problems as many other countries in Europe. Reagent and extraction kits were running low, and many countries were competing for the same supplies. So I guess all of Europe is competing for the kind of same lab supplies to actually run the tests. And it's only really in the last few weeks that I think countries have started looking to China and further afield to get the missing supplies.
Okay. Fair enough.
I was just going to make a very pedantic point. So you mentioned comparing, they initially said 15,000 tests a day, then I was saying they're doing 100,000 tests a week. Those are basically about the same number. 15
that
tests
is
a
totally
day works out to 105,000 tests per week, so basically the same thing. So they're now on course for the thing that they originally said they were going to do, basically.
That is fair. That is a very good point. I'm embarrassed by my lack of ability to do quick mental maths. So now, that wraps it up for Ireland. If we now, I didn't put in a lot about the US because we spoke about the US a lot in last week's video. We said a lot about how it took them a long time to actually take the, contagiousness of the virus seriously, how quickly it can spread. But in the last week or two, fair play, they have really ramped up testing, and thank God. So this is back to that Business Insider article saying that testing per capita now looks a lot different than it did in March. And this point here, on March 8th, South Korea's total number of tests done per million citizens was roughly 700 times that of the US, despite the two countries announcing their first cases on the same day. And now the US has a higher testing rate than the UK and France. So they really have, what's the phrase, pulled up their socks. So yeah, and I'm glad to hear it. And then, seeing as we were talking about Trump and the economy in last week's video, I wanted to include this little comment, where a report from Harvard says that to fully remobilize the economy in the US, they need to be testing 20 million people per day by mid-summer. And currently, the US is testing fewer than 200,000 people per day. Those are huge numbers.
Mm-hmm.
What do you guys think? Do you think something like that is even feasible?
Well, I think in America, which is one of the richest countries in the world, surely they should.
But I guess money really isn't the issue, right? It's not a question of like spending money on testing. It's being able to source enough for everyone.
Yeah, it's the resources and the infrastructure, and that just takes time, right?
Yeah, exactly.
Yeah.
I mean, they maybe will be able to reach that kind of testing per day, but obviously not in the near future. So
yeah, I was also just wondering, when did they want to fully remobilize the economy? Do we know?
I mean, I guess as soon as possible. But that comment was just kind of saying that if there was chance of it happening anytime soon, they'd be looking to ramp up testing by that much by midsummer, which is very close.
Yeah, that
very
seems
close.
optimistic.
Yeah.
Yeah.
I mean, that's kind of some of the issues that we've been seeing in a lot of governments. It's like promising things that they can't necessarily carry out.
Yeah.
So we're just setting ourselves false deadlines for things like remobilizing the economy or the end of lockdown or being able to test a certain number of dates. I don't know.
Yeah,
It's just all a mishmash.
Yeah.
Okay.
Although I think like one of the things you're saying is you're saying it ought to be easier in smaller countries than bigger countries, and therefore that's one of the reasons why it's harder than the US. And I think that's true to an extent. Like, sure, the numbers look scary, but you know, the US, sure, it has more people, but it also, has more hospitals in proportion with its number of people. And so I don't think being a big country is an excuse for not being able to reach a certain per capita testing rate. If that makes sense. Like, when you look at per capita statistics, there's no reason why bigger countries should be behind the smaller countries, right?
Yeah.
Yeah, definitely.
Yeah. I mean, there's definitely like everything. It's obviously a far more complex issue than just that. I mean, obviously
Sure.
there's the healthcare system in the US, which is its own problem, I believe. And so again, I have no place to like truly comment on how possible it would be for them to ramp up testing like that. Your point makes sense on a surface level. I do think, like you said, they have so many more hospitals to cater for so many more people, but I don't think it's as simple as that.
Oh no, it's definitely not simple. And the other thing is, once you've tested all these people and found all these cases, then you need to have those people isolate as well. And it'll be interesting to see, to what extent people comply with that.
Yeah.
Because that's the reason you test, right? You test to find people that have the disease, and then you want to make sure to keep them away from the population, and then hopefully you can ease the lockdown so that everyone else can go out and enjoy semi-normal life.
Yeah, definitely.
Yeah.
So now to move on to the UK, our close neighbours. Just a few things from Sky News here. These were taken like nearly within an hour of each other yesterday. So this one, government too slow on testing, lockdown, and medical gear. So the leader of the Labour Party said that he offered constructive opposition in his first Prime Minister's questions as Labour's new leader, as he faced Foreign Secretary Dominic Raab. So then, sorry, now if we move on, he accused the government of being behind the curve on lockdown testing and driving up supplies of PPE. Some nurses and doctors complain they are forced to work without it. I think that is a problem in a lot of countries. Daily Telegraph reported on Wednesday that a leaked document revealed tests on thousands of NHS staff were found to be flawed. A lot of articles saying that some of the initial testing kits in the UK were faulty and that scientists are recommending they retest any flawed samples.
Wow.
My goodness.
Yeah, that was something I was going to ask about. Is do you know what the accuracy of these tests are? Like, if a test tells you have coronavirus, like what are the chances of that test being wrong? Is that, I guess it varies a lot from test to test.
It does. So the diagnostic tests, the swabs, are a lot more sensitive than the antibody tests. So really most countries are using the swabs, even to the point where the UK has said they haven't started using the antibody testing because they aren't satisfied with how accurate any of them are. And I mean, I saw things where some of the antibody tests were maybe 93 to 96% sensitive to the virus. Those seem high to me, but apparently not high enough for some countries to start availing of the antibody testing. So, I mean, if those are the statistics for the antibody tests, I assume the swabs are quite accurate.
I guess the problem potentially is if you're testing the widespread population and more people don't have the virus than do have the virus, then you only need a fairly small rate of false positives before actually most of the people that you detect as having the virus actually don't have it. Because let's say, for example, you test 10 people and one of them doesn't have the virus. Sorry, one of them has the virus, 9 people don't, and your test gets it right 90% of the time. What that means is you're probably the one person who does have the virus, they'll probably be correctly tested to have the virus. But then of the other 9 people you test, there'll probably be one of those that you test, and the test will say that they have the virus when you don't. So you end up having a situation where you have a 90% accurate test, but actually half the people that you've said have the virus actually don't have it. And that's why numbers that sound quite good are actually not that good. Does that sort of make sense?
Of course. And with something like this, you need really high accuracy. So I can understand why 96% sensitivity in the case of the antibody tests doesn't cut it for people relying on them solely. I see that the US have started using them for emergencies. I mean, if they're running short on other tests, absolutely. Here we have, again, from yesterday, Matt Hancock tells us that we are at the peak of the COVID-19 outbreak. We've said a few times in this video that it's hard to really comment on these things. So it's interesting how many people, an MP, not a doctor or a virologist or epidemiologist, coming out with this. So yeah, in the last 24 hours, so talking from Tuesday, 18,000 tests were carried out, despite the UK government having said they now have the capacity to double that number. Health Secretary has said the government will be allowing more people to be eligible for tests and would make testing easier to access. Samia, you said there that in the UK, at the moment, they're only testing health workers, people in hospitals, people likely to be in contact with it. I've seen a few things where Matt Hancock was saying that it doesn't seem like there's a huge demand. Like they're not what's the word? They're not inundated with tests with those restrictions. So that's why he's talking about making it easier to access. He also explained how contact tracing would now play a key role. I think Ireland have been doing contact tracing since the start, following South Korea's model. But by the looks of things, the UK have only really started to depend on it recently. So yes, would now play a key role as the UK overcomes the peak of the outbreak. I'll move. Oh, sorry, I have clicked the wrong thing. My laptop is hard to. Here we go. So now, next slide on the UK. This article by the BBC.
Annie, I don't think you're sharing your screen.
Sorry, one sec. I am all over the place.
Oh, no.
Haha, here we go.
Oh. Hey,
dogs. Oh, wait.
Oh no, it's a spoiler. It's a spoiler. You guys weren't meant to see that yet. Oh
no. Oh no.
Okay, pretend you didn't see that.
No dogs.
Okay, back to doom and gloom for now. So yes, BBC News. The UK government wants to do 100,000 tests a day by the end of April, but has faced criticism for not increasing the number more quickly. By mid-April, 21,000 tests were being conducted a day, not much more than Ireland, on 14,000 people. So at first, Public Health England was only using its own 8 labs to carry out tests, later expanding to a further 40 NHS labs. I don't understand how they ever thought they could depend on only 8 labs to run tests for a population of 60 million people in the UK. Then it was only at the end of March that the government said it would work to involve more labs from universities, research institutes and private companies. As Samia said, at the moment tests are reserved for seriously ill patients in hospital and for certain key workers. And as well, some of the kind of roadblocks that the UK have hit, as well as the lab space and people to do the swabs, testing efforts have been held back by challenges of getting swabs and testing kits and reagents. So like other countries, all of us kind of competing for the same stockpile. The UK government are now trying to ease the shortage of reagents by getting pharmaceutical companies like GSK, and I'm not going to be able to say that, to make them in the UK.
AstraZeneca.
There we go. So. Then from The Guardian, this is what I mentioned earlier. Scientists raise concerns about the quality of UK COVID-19 tests. This is from Sunday. Internal PHE document shared with The Guardian suggests that supply chain issues hampered the UK's ability to ramp up the numbers of tests and may have also negatively affected the quality of testing because labs have had to rely on substandard chemicals and reagents. Document notes that discordant results. Oh, my feed has cut off. Did I cut out there?
No, you're fine.
You're fine. Yeah.
Sorry, it's cutting out on my end because, sorry, I am in city centre, so I think everyone is using the internet at the moment.
Oh, no.
So here, the dogs. Okay, so we're nearly at the dogs. So. Internal PhD document, blah, 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 have been identified, warns laboratories to retest ambiguous results before calling it a negative. So that is an issue, as well as having to ramp up tests, having to repeat tests. Yeah, is definitely a roadblock. Any comments?
I just, frustrating.
Oh no, Sam, you go.
We're just being promised one thing, and then they're relying only on 8 laboratories. I think
now it has been ramped up. I mean, there's 40.
Yeah, of course. And I think pharmaceutical companies should have been stepping in earlier, probably. That's a key point I would say.
I think that's one of the things they did in South Korea as well. Like the government got together all of these private companies and kind of asked them how they could help and like what they would do to help the government. And I think the kind of collaboration between the private companies and the state sector really helped there.
Yeah.
I think the other thing they did there is that they actually put a lot of scientists in positions of control in terms of actually like running the sort of the response to the outbreak, whereas here we kind of still have the politicians running it, albeit taking advice from the scientists. I think actually there the politicians stepped aside more and put various people from their sort of I forget the name of the organisation, but their sort of epidemiology unit.
Yeah.
I think we can all learn from South Korea, basically.
Yeah, I think that's maybe the bottom line from this week.
Just to finish up on the UK here, as I was saying about the antibody tests, UK government has said it will not make tests available until they are assured of their accuracy. Matt Hancock said that 15 of the most promising antibody tests have been tested, but none were good enough. The World Health Organization's head of emerging diseases said that while these tests measure the level of antibodies in the blood, there is no evidence they can show that an individual is immune or protected against reinfection. And I wanted to include that because I've seen a lot of people, make comments about, if you've had it, you are immune, or some countries still thinking about adopting this herd immunity model when we don't know if it actually works. I just want to include that before I finished up.
Yeah, I think I saw an article saying that actually they tested the number of antibodies of various people who'd had the virus, and they were sort of lower than might be expected. So that's again evidence that it might not give you immunity, but I think it's still very much up in the air. Right, dogs.
Dogs.
But not me. So to not finish up on a gloomy note, poppers. I had to include poppers. So this article came out from RT yesterday. I was very happy to read this. Can dogs detect COVID-19? Canines in training to sniff out the virus, and this adorable little woofer. So. This British charity.
Fake news?
This British charity, Medical Detection Dogs, was set up in 2008 to harness dogs' sharp sense of smell to detect human diseases. And they started work on the project late last month. In its training room in Milton Keynes, dogs are intensely trained to sniff out samples of the virus and indicate when they have found it to receive a treat. I heard something about their sensitivity being compared to that of humans, where if you were to drop something into a glass of water that humans would be able to smell from the glass of water, you could drop that into an Olympic-sized swimming pool, and a dog would be able to sniff it out. So
Amazing.
you know that is the comparison there. The approach is based on a belief that each disease triggers a distinct odor, which canines are uniquely well placed to smell. And they've already worked on previous projects for dogs to detect cancers, Parkinson's, bacterial infections. So, you know, some promising previous data. This quote here: "We believe dogs can detect COVID-19 and will be able to screen hundreds of people very, very rapidly, so we know who needs to be tested and isolated." That's Claire Guest, founder of the charity. She's working with the London School of Hygiene and Tropical Medicine and Durham. And this team recently collaborated to show that dogs can detect malaria. So this isn't just like a kind of all good news story, dogs. It's actually science. It seems promising. Team is aiming to train the dogs over a 6-week period to help provide the rapid non-invasive diagnosis tool. And finally, if successful, the 4-legged detection devices will be deployed at airports to identify people carrying the virus, according to Steve Lindsay from Durham University. So that is all from me.
Nice.
There we go.
Good. Cool.
That was cute.
I had to finish up on that note.
That's a good note to finish on. I don't even care if it's less effective than the other tests. It's cuter.
Okay, amazing. So thank you everyone for tuning into the second episode of Pretty Huge Disaster, Life Under Lockdown. If you can't catch these or don't have time to sit and watch us fumble over our laptop for an hour, we also have a podcast version, so check out our Spotify for the last episode and this one, which we'll try and upload in the next few days. Apologies for my incapabilities with technology today. I'm absolutely going to blame it on Dublin City Centre Internet, but that is all from us for this week. Thanks so much for tuning in. We hope to see you again next week, Thursday at 1 p.m.
Thank you. Bye.
Bye-bye.
Bye.